When we walk through the doors of a hospital, we operate on a deeply ingrained assumption. We surrender our physical autonomy, trusting that these sterile corridors offer a baseline of protection and that the people in scrubs are there to keep us alive. But that exact vulnerability attracts a specific kind of predator. Criminologists call them the angel of mercy or angel of death. These are serial killers drawn to the medical field by a pathological obsession with the power of life and death. This chart illustrates their alarming efficiency. On average, a medical professional who murders claims 2 patients every single month. Catching them is difficult because they know exactly how to manipulate the paperwork. They use specialized medical knowledge to camouflage lethal doses as standard illness progression. When a killer can successfully hide in plain sight, looking at the bodies isn't enough to stop them. Instead, investigators focus on 3 specific behavioral profiles discovered across decades of forensic analysis. These profiles represent 2 extremes of clinical psychology. The mercy killer operates under the delusional belief that they are easing a patient's suffering. The sadist, however, uses their clinical authority for absolute control over the helpless. Take the 19th century nurse Jane Toppin. During her murder trial, she confessed to a profound sadistic drive, admitting she was sexually aroused by the act of watching her victims die. Her methodology was intensely personal. She would administer a custom lethal mixture of drugs and then physically climb into bed with her patients, holding them close to her body as their hearts stopped. Toppin's crimes were horrific in their intimacy, but modern medical access allows killers to operate on a different scale. This brings us to the English family practitioner Harold Shipman. Shipman weaponized patients' existing diseases, using their deteriorating health as the cover for his lethal injections. By the time he was caught, he had a confirmed body count of over 215 people. Whether driven by physical thrill or an obsession with systemic control, both the sadist and the mercy killer succeed by turning medical wards into private hunting grounds. Their most effective shield is the authority granted by the white coat. But there is a third profile, one that is psychologically complex and difficult to spot. Criminologists call them the malignant hero. In the late 1980s, a New York nurse named Richard Angelo demonstrated this drive. Unlike the sadist, Angelo did not seek his patients' deaths. What he craved was for them to endure a sudden, severe medical crisis. He would secretly inject his patients with paralyzing drugs. Then, as their breathing stopped and the monitors flatlined, he would rush back into the room to perform a fabricated rescue, seeking the admiration of his colleagues and the victims' families. Looking at this behavioral loop, clinical psychologists classify this drive as a professional version of Munchausen syndrome by proxy. It's a factitious disorder where a caregiver engineers a life-threatening crisis to satisfy their own need for praise. As this diagram shows, the addiction to validation escalates. They build a tolerance to the praise. Eventually, they begin inducing cardiac arrests in healthy patients who originally came in for minor, treatable conditions. Because they control the medical charts, clinical oversight rarely detects them. They dictate exactly what goes into the body and exactly what goes onto the death certificate. More often than not, they are brought down by their own actions outside the hospital room. Harold Shipman was finally caught due to a forgery of a victim's will, while historical killers like H.H. Holmes were involved in insurance fraud schemes. The malignant hero's need for validation eventually outgrows their ability to hide the evidence. Their compulsion bleeds over into their finances and paperwork, tripping systemic alarms that expose what they've been doing in the dark. A modern hospital is a complex ecosystem, but its foundation isn't technology or medicine. It is built entirely on blind, unquestioned trust. The angel of mercy phenomenon weaponizes the medical social contract. These predators use the inherent helplessness of the sick to gain unmonitored access to their victims. This reveals a paradox at the heart of medicine. The exact chemicals, their specialized knowledge, and the bedside access required to save a human life are the exact same tools required to end one. These predators are statistically rare. Yet their existence demonstrates that the same environments built for recovery also provide the access and anonymity required for those who want to play God.